Hello, this is Dr. Lauren Hyman, and welcome again to Scooch Down, where you can talk to your gynecologist like you talk to your friends. A lot of women come to my office with complaints of bleeding, and some of the different things we look for to see if this might be causing the bleeding is a problem with the uterus. We look for fibroids, we look for polyps. Many women are wondering what the difference is between a fibroid and a polyp. We're going to discuss that. Both of these conditions are situations in which one cell has divided over and over and over again to make a benign growth. A fibroid is a situation in which a cell from the muscle of the uterine wall has started to divide. It's made almost a rubber cement ball. This rubber cement ball can be in the outer aspect of the uterus, where it changes the outer shape or contour of the uterus and actually can push on the bladder or on the bowel. The rubber cement ball can be in the muscle of the uterus and can cause heavy periods because the muscle can't clamp down during the period and really control the bleeding. And this fibroid can be in the lining of the uterus, where heavy bleeding occurs during periods, again because there's a defect in the lining, and when the period sheds, when the lining of the uterus sheds, the fibroid causes the shedding to be heavy. A polyp is where a single cell divides and divides and divides, but the cell of origin is not from the muscle of the uterus, it's from the lining of the uterus. And there is almost a finger-like projection coming out from the lining of the uterus from this growth. That finger-like projection can be anywhere in the wall of the uterus, and it can even be poking out of the cervix. So when a doctor does the evaluation for heavy bleeding and she puts in a speculum, sometimes she actually sees the polyp coming out through the cervix. The origin of that polyp can be even in the endocervical tissue. Sometimes, as part of an evaluation for heavy bleeding, a doctor will do a hysteroscopy or put a camera in the lining of the uterus after putting fluid into the lining to distend it. If there is a fibroid that's pushing into the canal, that can be noticed. And if there's a polyp in the canal coming out of the lining, that also can be noticed. And both of these can be removed at that time. That's a little bit of an explanation of the difference between a fibroid and a polyp. Thanks for tuning in to Scooch Down. I'm Dr. Lauren Hyman. I'll see you next time.